All right, I will be talking about the ethics of ABA therapy. What is ABA? ABA is applied behavior analysis or behavioral therapy. It increases behaviors that are helpful and it decreases behaviors that are harmful or decrease learning. It is typically used for individuals with autism spectrum disorder. The history of ABA. So it used to be called behavior modification. There was no code of ethics, no repercussions for harm done to clients. It did not have adequate training. The trainings were like one day and then you were thrown into the job. There were people called radical modifiers who were ethical therapists working to improve the ABA therapy. Some of the improvements were proper training and consistent practices. ABA Now. So ABA Now has the BACB Code of Ethics, which is the guidelines for everyone to follow to make sure that we are being ethical and we are all doing the same protocols and procedures. We have proper training and supervision that is required. You have to do 40 hours of training and then you have to take an exam and you are supervised throughout your entire career. We do compassionate therapy, which is making sure you put your client's needs first, and we honor FCT, which is functional communication. Anti-ABA, they believe it is unethical and abusive. It causes prompt dependency. It puts compliance over honoring FCT. It causes PTSD. It's out of date and ineffective. And they stop stemming behaviors, and it's anti-autism. Pro-ABA, they believe that it adds tools to an individual's repertoire. It helps them gain independence and life skills. We honor FCT, and we only stop stemming when necessary. My stance on the topic is that ABA therapy is ethical when practiced correctly. You have to follow the BACB Code of Ethics. Work hard to always put the needs of your client first. Honor communication. Do not block stemming unless necessary. Make sure you meet your required observations and your reports are thorough. Consequentialism looks at the outcome. This is complicated in ABA because of the individualized programs. Some see success in progress while others do not. And there's not one outcome for every individual. Deontology focuses on intention of act or the act itself rather than an outcome. This is also complicated because, again, each program is different. It has different protocols. Not all protocols work on every individual. ABA has these rules. ABA has set rules and does not you don't make decisions based on what you believe or your personal morals. Ethics of care, there's harm versus care. Make sure you do no harm to your client. Fairness versus reciprocity. The fairness and reciprocity is kind of complicated because you're paying for services, so the reciprocity would be financial, so there's not like for sure fairness, but there is a set of guidelines to follow. Authority versus respect. The therapist has authority over the client, but the client or client guardian has authority over their services and their protocols. We work on compassionate therapy, and we understand the long-term dependence of ethics of care. What I learned that ethics has many different elements to it, and that it's important to look at ABA from every angle. Make sure you're following protocols rather than following what you believe. Do no harm. And I do understand the concerns of those who are against ABA, but you need to make sure that you are following, you are looking into the clinics that you want to go to and looking into the services and making sure that you're going to a place that will treat you or the person you are looking for services for well.